Dr. Darla, and I've called you here today to help me with something very important. But before we do so, my colleagues have told me I'm not silly enough, so we will start off with a joke. Why did a poultry cross the road? To get from point A to point B, of course. Ha 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 ha. Okay, moving on. But what you will be helping me with is something called surgery. But before we do surgery on our patient, I needed to talk about the scientific method. I'm going to be showing you a few words that I want you to be putting into your long-term memory. Okay. The first word in question, because in science we have lots and lots of questions, and we have the scientific method to try to help us answer some of those questions. So in this process, the very first thing we have is a question that we want an answer to. Before we move on to try to find the answer, we create a hypothesis. Now this is a very big word that pretty much means the same thing as your prediction. What do you think the answer to your question is going to be? That is your prediction or your hypothesis. Once you have your question, you have your prediction of what you think the answer is, then you will create and perform the experiment to find that answer. Now, while you are doing the experiment, you are making lots and lots of observation. You are noticing all the details and you are recording them in some way that you won't forget. Now, once you've done it once, that is not your answer because you must repeat. Repetition is the next word. We need to repeat the process over and over, the same experiment with the exact same details over and over. That is repetition. If we keep getting the same response every single time, then we can say that that is our evidence or our answer to that question that you had. That is your conclusion. Then you may end the process. Now, we won't be doing the scientific process today, but I wanted to show you these words because we will be doing surgery with these words. All right, I want to draw your attention down here to my surgical table so I can show you what you will be having as well. Now, you will have 3 or 4 patients depending on what your teacher gives you. You will have a word bank with those same words on it that I just showed you, and you will have your finishing paper right here. So, this is how this is going to work. Your patients have letters scattered around them. All those letters create one of these words. But I challenge you to flip over your word bank and not even use it to start with. First, just take your first patient and start cutting out the rectangle with the letters inside. Now, this is surgery. Surgically remove the letters. I mean, we're being very precise and very careful. We don't want to hurt the patient and we don't want to make any extra cuts on them. So, in order to do that, I bend my paper, my patient, just like this. Make a tiny little cut to start off with on that dotted line so that now my scissors can just squeeze right in there to start surgically removing this letter that I found here. I cut along the dotted line just very carefully so I don't make any extra incisions. Once that first letter is removed, I pause. Whoops, we don't want to lose the letter. That's why I pause. I take the letter and I put it right by the number 1 because this is my first patient. Right now it doesn't matter what order they're in, that comes later. Then I go back to my first patient and I keep removing all the letters until all of them are off my patient and right here by the number 1. When that's the case, then I try to unscramble them to see which one of those words it creates. I'm going to try to do it without looking at my word bank because that's high-level critical thinking. But if I get stuck, then I may look on here for a clue to see which one of these words I think it is. When I know for sure which word it is, and I know I have it spelled correctly, then I'm going to glue down each one of those letters, spelling out the word before I move on to the next patient. Then I may move on. So that I will either, depending on which paper my teacher gave me, turn in 3 or 4 words to that teacher. All right? Thank you so much for your help. Good luck.